other cardioembolic stroke. It can be valvular heart disease that resulted to a cardioembolic stroke. So when you hear at the level of the heart, you may hear murmurs at the level of the different valvular areas or auscultatory areas. You can hear murmurs there. Then the next one, so for valvular heart disease, you can hear murmurs. In cases of arrhythmias or atrial fibrillation, you can have arrhythmias at the level of the heart, but heart that is going to be irregular. The pulse is going to be irregular with a pulse deficit, and there's a variable amplitude. Is it clear? All that may make you think of atrial fibrillation. Is it clear? Now, the next thing after thinking of atrial fibrillation, you have also to think of ischemic heart disease. Ischemic heart disease, the patient may present with a history of a compressing chest pain. Is it clear? So when you have visualized all this, you need to know now to them if the etiology is an aneurysm. In cases of a hemorrhagic shock, how can you evaluate? Generally, it's difficult for you to evaluate for an aneurysm in a hemorrhagic shock, but there are other elements like you need to palpate the kidney in order to visualize for enlargement. Is it clear? At level of the kidney, because as you are showing, you can have aneurysm in the cases of a polycystic kidney disease. When you have aneurysm in a polycystic kidney disease, you can visualize enlargement at the level of the kidney, and the patient is going to have aneurysm. Generally, this polycystic kidney disease may also be associated with the liver cyst. Is it clear? So, or ovarian cyst or pancreatic cyst. So when this patient have different types of cysts, you can also palpate via the enlargement of the organs. The second thing is that aneurysm can be formed as a result of a tertiary syphilis. Is it clear? So in this case, you need to visualize the body of the patient in order to find if there are rashes. Is it clear? Because those rashes may come from a vasculitis, and that's another thing that I've forgotten to tell you. Vasculitis is another risk factor for a hemorrhagic stroke. It can result to hemorrhagic stroke, so you need to know to visualize for rashes all over the body. And when you have those pruritic or petechial rash at the level of when you have a petechial rash or purpuric rashes at the level of the skin, you may think of a valvulitis, and those valvulitis may result to a hemorrhagic stroke. Is it clear? So those are the different elements that you have to visualize in a case of a patient that are to evaluate for the case, the etiology of the ischemic or the hemorrhagic stroke on the physical examination. Now, still on physical examination, you bring out the complication of stroke. Is it clear? The complication of stroke can be, we have ischemic and hemorrhagic stroke. The first acute complication of stroke is that you can have a post-stroke seizure. Now, post-stroke seizure can only be evaluated now on the history. Is it clear? You can evaluate the post-stroke seizure on a history only. Is it clear? The second one, after evaluating the post-stroke seizure, after evaluating the post-stroke seizure, you now need to bring out the next element of in stroke, acute complication of the stroke. In the acute complication of stroke, we have post-stroke seizure, which can only be evaluated the history where the patient is going to tell you that they had a history of convulsion. Now, the second element that you have in patient with acute stroke, so you are going to have also hydrocephalus. Is it clear? Hydrocephalus. Now, hydrocephalus cannot be seen easily in adults. It can only be seen generally mistakenly when you do a CT scan and you're going to have dilation of the ventricles. And when you have that dilation of the ventricles, is it clear? It's going to be mostly as a result of subarachnoid hemorrhage, when the stroke is mostly a form of subarachnoid hemorrhage. The third one, you can have vasospasms, mostly still as a result of subarachnoid hemorrhage. The fourth one, after vasospasm, you can have vasospasm. The fourth one, you can have cerebral edema. Is it clear? Cerebral edema can be a reason of raised intracranial pressure after a stroke. Let's say that you have a patient that has stroke without raised intracranial pressure at the beginning, and then later on he starts having signs of raised intracranial pressure. And what are those signs of raised intracranial pressure? Is it clear? You need to know that what the signs of raised intracranial pressure are divided into three. You have mild signs of raised intracranial pressure, you have moderate signs of raised intracranial pressure, and you have severe signs of raised intracranial pressure. Is it clear? The mild signs of raised intracranial pressure are headache, projectile vomiting, dizziness, blurred vision, and also sometimes convulsion. Is it clear? Now, the major signs of raised intracranial pressure are the signs of cranial nerve palsies. Is it clear? When you have cranial nerve palsies, particularly cranial nerve 3 palsy, cranial nerve 6 palsy, and to assess those cranial nerve palsy, you need to visualize the movement of the eye, and the eye have movement of LR6SO4 all into 3. Is it clear? Where the lateral rectus is supplied by the abducens nerve, the trochlea supplies the superior oblique, and then the oculomotor nerve supply the rest. Is it clear? And then when you have severely raised intracranial pressure, you have papilloedema. Is it clear? That can be seen on fundoscopy. You have the Cushing triad. Is it clear? And that Cushing triad is a constituent of hypertension plus bradycardia plus bradypnea. And then the next one after the Cushing triad, hypertension, bradycardia, or bradypnea, you have the next in severely raised intracranial pressure, which can be in severely raised intracranial pressure, you have coma. When you have a patient in coma, it can also be severely raised intracranial pressure. And when you have others like decerebrate positioning. Is it clear? So those are the different elements that can make you think of severely raised intracranial pressure, and this can be as a result of an acute complication of stroke, which is cerebral edema. Is it clear? Now we have the chronic